In life, everything is very, very unpredictable. You can plan for it. You can plan for the next hour. You can plan for the next day, next year, next 10 years. But truth is that you don't know what is going to happen even next hour. So last night, I think about 11:30, then he came to say if we can go for a long drive today. Today is President Day, it's a holiday here, and she wanted to go to the sea beach. So plan was to go to the sea beach today, and now I am sitting in the emergency room in the hospital. So finally I got my room and back to my hospital uniform. It's about to have a 1 year anniversary, and I guess celebrating that today in the hospital.
What were you doing when you passed out?
So I was in the bed, I was sleeping. Then my room heater actually turned on. So I just got up from the bed to turn that off. I get a little bit dizziness when I get up from the bed or chair, but yesterday it was different. Then I hold some furniture over there because during the blackout, I likely rolled and threw myself against the furniture before eventually hitting the wall, leaving a dent there. I don't. I was of course unconscious on and off.
Yes. Do you know how long that you were passing out?
Total about based on my wife and daughter, it was about 2 minutes, 2 to 3 minutes. But in between, I probably got consciousness for maybe at least once or twice.
So, but no one actually witnessing, right? They just see you already.
Yeah, room was dark. My wife was next to me, but she was sleeping, of course. I don't fully remember what happened, but I got occasional consciousness and recall hearing my family talking to 911 representatives. Yet I could not see anything at that time. And eventually, when finally I woke up, I was all sweat and wet. My floor was all wet, but I started feeling much better. So I decided to clean myself. In the meantime, the EMT team was here and they ran all the tests. They ran the ECG or EKG. They ran the blood pressure, but all looks okay. But EMT team wanted me to go to the emergency given my heart condition. So finally I ended up to the emergency care. They need to run multiple tests now to determine the cause of the blackout, assess any internal damage, and identify any necessary additional treatment or procedure needed. Now here I am sitting, waiting for all the tests done, that including the blood sugar, blood test, urine test, CT scan, X-ray. They have to do all those things to rule out all the possibilities. Because they have to do the X-ray, I believe, because they want to make sure that all the surgery areas are intact, nothing is wrong there. They have to do the CT to the brain is because they have to make sure the brain, everything is okay. There are no blood clot or anything there. They have to run the blood test to make sure everything is all aligned. So it is going to be a few hours, and meanwhile I am not supposed to eat or drink anything, and I am very, very hungry. That is also because based on the test, if they find something else, they have to run a procedure, and for that I am supposed to be in the empty stomach. So I am now waiting to know my fate, what is going to happen. But if they find something wrong, they are going to run another procedure, which can be even the surgery. So life, you plan something, but you get something else. It is unpredictable. That is how life is. When you are a heart patient, you are a heart patient for forever. Your life is never going to be the same again anymore. So I was totally normal yesterday, and today I am now in the emergency. That is life after having a heart surgery. Heart is one of the very sensitive organ. Once someone touches, it's acting really, really weird. It's never behaved the same it used to. So after about 4 to 5 hours, the doctor came in and told me that all reports looks fine and there are no internal damage. However, they could not determine the cause for the blackout. To monitor any abnormalities, they attached a device here to track my heart for next 14 days. So the big question now is that why did I have this blackout? My day was as normal as any other day and I took my medicines on time. The only thing different is that I have been taking a lower amount of blood thinner for a week now. And for the first time in last 1 year, I ate Chinese food today, which was very high in salt. And could that be the reason? I don't know. But what I do know is that I need to be more careful. Just when I thought that I am back to normal after 1 year of my surgery, it was a harsh reminder that I am really far from being normal.